Insulin resistance is becoming increasingly common among seniors, especially those over 60. Did you know that nearly 1 in 4 seniors are affected by insulin resistance? And this number continues to rise. This condition is crucial in diabetes management, as it prevents the body from using insulin effectively, causing higher blood sugar levels and increasing the risk of developing type 2 diabetes and its complications. But what if I told you that your skin could be giving you critical clues about your blood sugar levels before diabetes even develops? In today's video, we're plunging into the 5 key skin signs you need to keep an eye on, as they could indicate your blood sugar is out of balance. Left unchecked, these signs can increase the risk of developing type 2 diabetes and other serious complications. Get ready, because the 4th sign I'll reveal might surprise you. It's a vital one for managing your health effectively. Before I get started, make sure to like this video and subscribe to Golden Aging Health for more life-saving tips tailored specifically for seniors. You won't want to miss out on the valuable health insights we share to help you live your best, healthiest life. Now, let's jump right in and take a closer look at the first skin sign that could be silently signaling a serious health issue for many seniors. Sign number 1. Diabetic blisters. Have you noticed mysterious blisters on your hands, feet, or arms? These blisters may seem harmless at first, but they could actually be a warning sign of insulin resistance or high blood sugar levels, both of which are precursors to type 2 diabetes. While they may resemble burn blisters, diabetic blisters are linked to poor blood sugar control and can appear unexpectedly. Typically, these blisters are round, filled with clear fluid, and appear on areas like the hands, feet, or arms, often mistaken for something less serious. According to the American Diabetes Association, these blisters can serve as an early signal that your insulin resistance might need adjustment. While these blisters themselves are generally not dangerous, their presence can hint at underlying issues like diabetic neuropathy or increased susceptibility to skin infections. Let me tell you about Margaret, a 72-year-old woman I know who has been living with insulin resistance. One day, Margaret noticed a small blister on her foot. She thought it was no big deal and didn't pay much attention to it. However, the blister grew and started showing signs of infection. Her doctor explained that her elevated blood sugar levels were the cause, and with early intervention, she was able to get her condition under control. Had she ignored it, the situation could have worsened. Do you notice unexplained blisters that don't heal quickly? These could be signs of insulin resistance or prediabetes. If so, it's important to reach out to your healthcare provider for further guidance. I'd love to hear your experiences. Have you perceived any skin changes related to insulin resistance or prediabetes? Your story could be the crucial sign that someone else needs to take action and manage their health better. Next, let's look at the second common yet often overlooked sign of insulin resistance: dry and itchy skin. A common yet often overlooked symptom of high blood sugar. Sign number 2. Dry and itchy skin. Last spring, Mr. Robert Jenkins, a 68-year-old retiree from Ohio, began scratching his legs every night. At first, he blamed it on the dry air or maybe a new detergent. But over time, the itch turned into red, cracked skin on his shins and arms. Nothing seemed to help. His wife insisted he get it checked. The surprise? His fasting blood sugar was over 140 mg/dl, and his A1C was 7.1%. He had insulin resistance, a precursor to type 2 diabetes, and this dry skin was the first warning sign. According to the Mayo Clinic, high blood sugar can silently dry out your skin from the inside. When glucose builds up in your bloodstream, it draws water from your tissues, leaving your skin dehydrated, less elastic, and more prone to cracking. Imagine it like a sponge left out too long. It becomes brittle and eventually breaks apart. For seniors, this issue is especially concerning. As we age, the skin loses oil glands, and combined with insulin resistance, it becomes a breeding ground for itching, flaking, and even infections. Dryness often appears first on the lower legs, forearms, and hands. You may also feel a burning or tingling sensation. Both are signs of nerve irritation caused by high blood sugar. Here's how to protect your skin. Apply rich, unscented moisturizers with ceramides or urea right after bathing to lock in moisture. Limit showers to 10 minutes, using lukewarm water, not hot, as hot water can make dryness worse. Drink plenty of fluids. Even mild dehydration worsens skin issues. And most importantly, if dry skin persists or worsens, it's time to ask your doctor about testing for insulin resistance or prediabetes. Don't go anywhere, because next, we'll highlight another crucial but often overlooked sign of prediabetes. Catching it early can provide valuable insights into your health and help prevent complications. Sign number 3. Skin tags and diabetes. Did you know that nearly 70% of people over 60 who develop insulin resistance or type 2 diabetes often ignore early signs like skin tags? These small, soft growths may seem like harmless age-related changes, but they could be a red flag that your blood sugar is out of balance. Ignoring these signs might mean missing an early indication of insulin resistance and can increase the risk of developing more serious diabetes-related complications. Not long ago, I spoke with David, a 72-year-old retiree who had been noticing small, soft growths on his neck and under his arms for months. He thought they were just skin irritations or part of aging, so he didn't think much of it. However, when his doctor saw the growths, she asked him a simple question: "Have you had your blood sugar checked recently?" That's when it hit David hadn't connected his skin tags to insulin resistance. His doctor explained that skin tags can be a sign of insulin resistance, a condition where your body doesn't use insulin properly, often leading to type 2 diabetes. Catching it early can help prevent more serious complications like heart disease or neuropathy. After a blood test, David found out his blood sugar levels were elevated, which confirmed he had insulin resistance. With early intervention, he adjusted his medication and made lifestyle changes to control his blood sugar levels. Today, he's feeling much better and keeping his blood sugar in check. David's story highlights research from Harvard Health, which reports that skin tags are commonly linked to insulin resistance, a precursor to type 2 diabetes. The difference? When diabetes is caught early, it can be managed effectively through lifestyle changes and medication, reducing the risk of complications. However, if ignored, insulin resistance can lead to serious health issues that impact the heart, kidneys, and nervous system. If you notice skin tags, it could be your body's way of signaling that your blood sugar is out of balance. Don't wait for these small signs to turn into bigger health problems. Take action early by seeking medical advice. If you have a loved one over 60, share this video with them. It could be the important warning they need to identify insulin resistance early and take action before more serious health issues arise. Here it is, the part you've been waiting for. Just as I mentioned earlier, the fourth sign might surprise you, and it plays a vital role in taking control of your health. Sign number 4. Slow healing sores. According to Dr. Laura Kim, a wound care specialist with over 25 years of experience treating diabetic patients, more than 70% of her patients with severe diabetic ulcers had signs of poor healing weeks before they sought medical help. If they had come in just 10 days earlier, she explains, we could have avoided major interventions, in most cases 7 amputations. That's why doctors always pay attention to this critical skin sign: sores that don't heal. It may start with something minor, a blister from walking, a scrape on the shin, or even a toenail injury. But if you're dealing with insulin resistance or prediabetes, your body's ability to repair itself is slowed down. High blood sugar impacts both circulation and nerve function, meaning you might not feel the injury, and your blood may struggle to deliver the nutrients needed for proper healing. If left untreated, this can lead to serious infections, gangrene, and, in severe cases, amputation. What does this look like in real life? A cut or sore that persists longer than 1 to 2 weeks, especially on the feet, legs, or toes. It may become red, swollen, or even begin to leak fluid. You may also experience numbness or tingling, signaling that nerve damage has already started. To stay ahead of this risk, it's crucial to check your feet daily, even using a mirror or asking a family member to help. Wearing soft, well-fitting shoes and moisture-wicking socks can reduce friction and irritation. If you notice any wound that isn't healing properly, don't wait to talk to your doctor right away. Because, as Dr. Kim puts it, one ignored sore today could become tomorrow's emergency surgery. Having discussed slow-healing sores, let's move on to the final skin sign, a crucial early warning of high blood sugar that you definitely don't want to overlook. Sign number 5. Acanthosis nigricans. This might be the sign you've been overlooking. Acanthosis nigricans may seem like just a skin irritation or a simple cosmetic issue at first, but the underlying cause could be more serious than you think: insulin resistance. Acanthosis nigricans typically appear as darkened, velvety patches of skin, often around the neck, underarms, groin, or elbows. At first, these patches might seem like a harmless skin condition, but they are often a warning sign that your insulin levels are out of balance, which can lead to type 2 diabetes. This condition is caused by insulin resistance, where the body has trouble responding to insulin, leading to high insulin levels. When the body produces too much insulin, it stimulates skin cells to grow rapidly, resulting in these thickened, dark patches. According to the American Diabetes Association, insulin resistance is common among people with type 2 diabetes, and noticing these skin changes early can be crucial to managing the condition. Early intervention can help prevent further complications, like cardiovascular disease or nerve damage. When you've noticed darkened patches on your skin, especially in areas of friction like the neck or underarms, it's time to take notice. Talk to your healthcare provider about getting tested for insulin resistance or prediabetes. If you've spotted dark, velvety patches of skin on your neck or underarms, drop a yes in the comments below. Sharing your experience might help someone else recognize the early signs of insulin resistance and take action before it's too late. To wrap things up, we've covered 5 critical skin signs that could indicate insulin resistance, a precursor to type 2 diabetes. From diabetic blisters and skin tags to dry, itchy skin and slow-healing sores, these signs often go unnoticed, but are key to catching blood sugar imbalances early. By recognizing them, you can take action to prevent more serious health issues. The most important takeaway here? Stay proactive in managing your health. Regular checkups, blood sugar monitoring, and paying attention to changes in your skin can make all the difference in preventing complications down the road. If you've noticed any of these signs, don't hesitate to talk to your doctor and get tested for insulin resistance or prediabetes. Early intervention can save you from more serious health issues. Remember to subscribe to Golden Aging Health for more essential tips to help you live a healthier, happier life. We're here to provide valuable insights and tools to help you stay on top of your health. Take charge of your health today so you can enjoy a healthier tomorrow. Thanks for watching, and we'll see you in the next video.